All right, this week we're going to talk about obstetrics and neonatology. So, obstetrics is the branch of medicine that deals with childbirth and the care of the mother before, during, and after birth. Neonatology is the branch of medicine that deals with the diagnosis and treatment of disorders of the newborn. What we have here are some images from your textbook. Basically, conception, fertilization, formation of a zygote, embryo, and a fetus. You'll see on the left here there are some images of the female reproductive system. Basically, conception is the beginning of pregnancy when a mature sperm cell enters a mature ovum. So during sexual intercourse, sperm will travel through the vagina up the uterus through the fallopian tubes where it meets an egg during ovulation, enters the egg, and is now formed into a zygote. The zygote continues cellular replication, travels down the fallopian tubes and implants into the uterine lining. So, implantation is the embedding of a zygote into the uterine lining. Process normally begins about 7 days after fertilization and continues for a few more days. Once the zygote is implanted into the uterine lining, it's known as an embryo. The embryo continues to develop up until the 8th week of pregnancy. After 8 weeks of development, it's known as a fetus. The fetus is the unborn offspring from the beginning of the 9th week until termination of the pregnancy. Gestational period, this is the pregnancy, time of pregnancy. So, gestational period, duration of pregnancy, normally 38 to 42 weeks, which can be divided into 3 equal periods called trimesters. Um, You'll see the image on the left is a fetus inside an amniotic sac, and the top portion above the amniotic sac is the placenta. So the placenta is a structure that grows on the wall of the uterus during pregnancy and allows for nourishment of the fetus, also known as the afterbirth. The amniotic sac is that kind of fluid-filled sac that cushions the baby. So membranous bag that surrounds the fetus before delivery, also known as the amniotic sac, commonly referred to as bag of waters. And the chorion is the outermost layer of that fetal membrane or sac. Some combining forms you're going to need for this chapter. Amnio or amniano is referring to amnion or amniotic fluid. Chorio is the chorion. Fedi or feto is the fetus, unborn offspring. Gravido, referring to pregnancy. Lacto, referring to milk. Nato, birth. Pero or parto is to give birth, to have labor, childbirth. Some more combining forms referring to neonatology or the baby. Cephalo is head. Apizio is vulva. Hydro is water. Hystero, uterus. Pelvi is pelvis. Primi, first. Pseudo, false. Sono, sound. Terrato is malformations. Prefixes for this chapter: anti, before. Dis, painful, abnormal, difficult. Intra, within. Micro, small. Multi, many. Neo, new. Nully is none. Poly is many. Post, after. Pre, before. And suffixes: amnios is referring to amnion or amniotic fluid. Seal is a hernia or a protrusion. Synthesis, surgical puncture to aspirate fluid. Cyesis is pregnancy. Gen, substance that produces or causes. Rhea, flow or discharge. Rexis, rupture. Tosha or tokia, birth or labor. Disease and disorder terms from obstetrics here. Dystocia is difficult or prolonged labor. Hysterorexia is a rupture of the uterus. Abortion is the termination of pregnancy before viability. So viability is typically at about week 20 of pregnancy. So if you have a termination of pregnancy before week 20, it's known as an abortion. Abruptio placentae is premature separation of the placenta from the uterus. Preeclampsia is a condition found in pregnancy characterized by high blood pressure, protein in the urine, proteinuria. This is during pregnancy or the first few weeks after delivery. This can progress into something known as eclampsia, which has the characteristics of preeclampsia, like hypertension and proteinuria, but then also convulsions or seizures. This is a life-threatening condition and can cause death to the mother. An ectopic pregnancy is a pregnancy that occurs outside of the uterus. Most commonly, it's going to occur in the fallopian tubes. So the pregnancy, the zygote embeds or implants into the lining of the fallopian tube or somewhere else outside of the uterus instead of the uterus. Placenta previa, the placenta, it grows, it implants, the zygote implants too low inside the uterus, and then the placenta will grow over the cervix, which is the opening into the vaginal canal. So this can cause bleeding, separation of the placenta, non-viable pregnancies. Some disease and disorder terms for the neonate. Microcephalus is a small head. Omphalocele is a hernia of the umbilicus, umbilical hernia. Cleft lip or cleft palate is a split in the lip or the roof of the mouth. Coarctation of the aorta is a stenosis or hardening of the aortic arch, which is a large vessel where blood passes straight out of the left ventricle. Down syndrome is a chromosomal abnormality, genetic chromosomal abnormality, characterized by varying degrees of intellectual, developmental, and physical traits. Esophageal atresia is an absence of part of the esophagus. So part of the esophagus is missing, so food can't pass down through the esophagus into the stomach. Respiratory distress syndrome is a severe respiratory illness, very common in neonates that are born prematurely, and the respiratory system hasn't developed fully before the time they're born, so they'll have respiratory distress syndrome when they're born. Spina bifida is a defect of the vertebral column. The vertebral arch fails to close during development, and part of the spinal cord or the meninges can herniate outside of the protection of that bony structure in the vertebrae, and there can be related neurologic problems at the area affected and below, typically. And some surgical terms for this chapter. Amniotomy is an incision of the amnion. This is also known as like induction of birth. The doctor will use a hooked instrument to rupture the amniotic sac and hopefully stimulate contractions and vaginal delivery. Episiotomy is incision into the vulva. So the doctor will make a cut actually into the external genitalia, the vaginal opening, if they're worried about tearing, to prevent tearing during vaginal delivery, or to also facilitate vaginal delivery if they need more room. A cesarean section, a C-section. So the birth of a fetus through the mother's abdomen and uterus, there's an incision made, and actually the baby is removed not through the vagina, but through the abdominal wall. In vitro fertilization, an ova is fertilized outside of the body and is allowed to develop, and then that zygote, the developing cells, will be implanted into the uterus and hopefully result in a viable pregnancy. And lastly, some complementary terms. Gravida is referring to pregnancies. Para is births. Antepartum is before childbirth. Colostrum is a milky fluid that's excreted from the breasts for the first few days after birth of a child before lactation begins. This is a very highly nutritious filled fluid that the baby really needs. Quickening is the first feeling of movement of the fetus in utero by the mother. So when the mother can feel the baby moving, typically around week 20. Midwifery, or a midwife, is someone who assists in childbirth. Obstetrics is a specialty, a medical specialty dealing with pregnancy and childbirth and the care of the mother shortly after birth of the child. All right, good job. Obstetrics and neonatology. There's a lot of stuff on the chapter I couldn't or didn't go over. So make sure you read the book, use the exercises in the book to practice. Do your activities assigned to you in Canvas. Also, there's a discussion this week. Discussions are worth a pretty big portion of your final grade, so make sure you participate in the discussion. There's a rubric in there that tells you how you'll be graded, so make sure you get your full points. And then do the quizzes, and please reach out to me if you have any questions or you need anything. You guys are all doing great. We're on the second half of the semester, so it'll be over before you know it. Keep up the hard work. Thanks.